Hi, my name is Chin Rodgers, and I'm from Milwaukee, Wisconsin, and this is my PA Spotlight. So, ever since I was a kid, I loved medicine. I loved the smell of hospitals. I loved the idea of going into the hospital. I got to see doctors and nurses and things in progress. I loved blood. I loved gore. I was a weird child. But I came from Malaysia, and we did not have PAs in Malaysia. So I came to school in the US hoping to get into the medical field, and I wanted to be a doctor. In my first year at Marquette, I met this amazing teacher. He was my anatomy professor. So if you're listening in, Dr. Cullinan, you rock, and thank you so much. He was the anatomy professor at that time, and he was really a champion of PAs. And so he told me about the PA program that we had at Marquette University, and it's like a 5-year accelerated program if you join in as a freshman. I had already been like a second semester, like sophomore transfer, but because he told me about the program, I was able to apply in time, and I was able to get into that 5-year accelerated program. So I became a PA, and the role fit me, and it was amazing. So, what specialty I work in? I work in emergency medicine for the past for 16 years, and then in the past 3 years, I've transitioned into urgent care medicine. So, I work in urgent care. It's a step down from emergency medicine, but it's still exciting enough for me. We still see kind of very sick patients that we have to transfer to the emergency department. We start the care first, we put in the IVs, we make the decision to transfer, we call the ambulance, and then we make sure the patient gets safely there where they need to be. Uh, what does a typical day look like for me as a PA? So it varies from day to day. There's really no typical day, and that's probably why I love emergency medicine and urgent care medicine. Like, you never know what you're gonna get. Generally, I kind of psych myself to go into work. I have about a 30-minute drive, so I kind of like blast some music. I get there. I kind of start by like putting away my lunch. I wipe down like all the surfaces because I'm a tiny bit of a germaphobe. And then I get everything ready. I sign in, and then I take all comers. Like, there's people just walk in when they need to be seen, and our job is to see them as soon as possible, give the best care, and then if they are super sick, we get them out fast. I go to lunch. Um, let's see. I generally like Asian diet. So I grew up in Asia. I like Asian food. It's usually a rice with a vegetable and a protein. Sometimes we go really wild and we order food in with pizza. Can I tell this crazy story about what I ate? One time I worked so many hours I did not get to eat dinner, and it was a 12-hour shift. So then I passed by my local burger joint. No, actually, that's not true. I opened the app at the end of like my work shift, and I start ordering the burger. And I ordered the biggest burger with a double patty. It also has cheese, lettuce, fried onions, tomatoes. It had onion rings and fries in the burger. It's called the KRK, and it is at Cops in Milwaukee. And if ever come to Milwaukee, that's where it's at. And I ate the whole thing. I I passed by, picked my burger up, and then I went home and I proceeded to eat the whole thing. It was amazing. That was the best meal. Are there any PA specialties that I find fascinating? So there's a new thing that just came out over the last couple of years, and it's called an inboxologist. Have you ever heard of it? Inboxologist. So basically, busy practice, people order labs and stuff, and they need, like imaging and all that, and they need somebody to follow up on the results. And then also patients have questions. It can add like a lot to your practice, especially if you're so busy and that there's really no time to like answer all these inbox questions and also like get to all these lab results. So a person could work from home and they could look up all the labs, see, okay, this person has this, results come back, that urine maybe needs a tweak and you need to tweak the antibiotics so that, it's covering the organism that grows out. So that patient gets a phone call from you, you do all this from home, you get them a new antibiotics to the pharmacy that they want, and you make life easier for your colleagues and you make life easier for your patients. So that's a really cool one. I think the most obvious advice to give somebody who wants to be a PA is to love what you do. And it's so trite. Everybody's like, man, but man, if you don't like people and you don't love what you do, I don't think you can do this job. This is a really hard job. It's very specialized. You get a lot of medical training, but it's a people job. You just gotta love people. You gotta love talking to people, understand what makes them tick. You need to be able to communicate effectively, and you gotta get patients to buy into your sort of treatment plan for them, right? If they don't trust you, they don't believe you, they don't think that you're doing the best for them, they're not gonna listen. They're not gonna be compliant. They're gonna say, well, another number, like just keep on going, I'm gonna do whatever I do. But if they believe you, they trust you, they want to do good for you, it helps them too. It's amazing.